rotator cuff tears, and the role of Regeneten in modern treatment. Introduction. Good day and thank you for joining me. Rotator cuff tears are a prevalent issue in orthopedic practice, often resulting in significant pain, functional limitations, and reduced quality of life. These injuries, common in middle-aged and older adults, can severely impact a patient's ability to perform daily activities. Traditional surgical treatments, while effective, often come with limitations such as prolonged rehabilitation and variable outcomes. Today, I will discuss the anatomy and function of the rotator cuff, the causes and clinical presentation of rotator cuff tears, and introduce the Regeneten Bioinductive Implant, a groundbreaking technology that is revolutionizing rotator cuff repair. Regenten's innovative approach enhances tendon healing biologically while streamlining the surgical and recovery processes. I will also highlight surgical techniques and share insights from my clinical experience, emphasizing why Regeneten is a transformative tool for both patients and surgeons. Understanding the rotator cuff, anatomy and function. The rotator cuff is composed of 4 muscles and their associated tendons. 1. Supraspinatus assists in arm elevation, particularly the initial phase of abduction. 2. Infraspinatus facilitates external rotation. 3. Teres minor supports external rotation and stabilization. 4. Subscapularis plays a key role in internal rotation of the arm. These tendons form a cuff around the humeral head, stabilizing the shoulder joint by centering the humeral head in the glenoid cavity during movement. This stability enables a wide range of arm motions essential for everyday tasks, such as lifting, throwing, and reaching. The high mechanical demand on the rotator cuff, combined with its relatively poor vascularity, makes it particularly susceptible to injuries from chronic degeneration or acute trauma. Rotator cuff tears, etiology, and symptoms. Rotator cuff tears occur through various mechanisms. 1. Chronic degeneration. Age-related changes, such as reduced vascularity and tendon thinning, lead to cumulative wear and tear. Repetitive stress from overhead activities accelerates degeneration, particularly in athletes in labor-intensive professions. 2. Acute trauma. Sudden injuries, such as falls or heavy lifting, can cause partial or complete tears, especially in younger individuals. 3. Contributing factors. Subacromial impingement and bony spurs compress the rotator cuff, exacerbating wear and tear. Symptoms commonly include pain during overhead movements or at night, particularly when lying on the affected side. Weaknesses, making it difficult to lift or rotate the arm. Functional limitations, impacting tasks such as tracing or reaching for objects. Regeneten Bioinductive Implant, a new paradigm in treatment. The Regeneten Bioinductive Implant represents a significant advancement in rotator cuff repair, addressing the limitations of traditional surgical techniques. Unlike conventional methods that focus solely on structural repair, Regeneten enhances biological healing by stimulating the growth of new tendon-like tissue. Key advantages. 1. Bioinductive tissue regeneration. The implant's type I collagen matrix stimulates the body's natural healing processes, promoting the formation of new, organized tendon-like tissue over the repair site. This biological reinforcement not only repairs the existing tear but also strengthens the tendon, reducing the risk of future retears. 2. Enhanced structural integrity. The regenerative tissue integrates seamlessly with the native tendon, improving its overall quality and durability. This ensures a more robust repair, even in patients with poor baseline tendon quality, such as older individuals or those with chronic degenerative changes. 3. Minimally invasive application. The implant is deployed arthroscopically, reducing surgical trauma, operative time, and post-operative discomfort. Smaller incisions and reduced tissue manipulation translate to shorter recovery times and fewer complications. 4. Accelerated healing. Regeneten allows for earlier mobilization and faster progression through rehabilitation phases. In my experience, changes in tendon structure are often visible on post-operative MRI as early as 1 week, indicating rapid biological response and tissue regeneration. 5. Pain reduction. Patients consistently report significantly lower pain levels after Regeneten procedures, which reduces reliance on narcotic medications and improves overall recovery experience. Surgical application of Regeneten. The versatility and ease of application make Regeneten suitable for both partial and full-thickness rotator cuff tears. My clinical practice has demonstrated the importance of specific surgical techniques to optimize outcomes. 1. Precise placement of anchors. For accurate targeting of the repair site, I recommend placing staples at the just lateral margin of the acromion. This technique simplifies the process, ensures optimal implant positioning, and enhances the effectiveness of the repair. 2. Adaptability to tear types. Partial thickness tears. The implant alone can stimulate tissue regeneration, often eliminating the need for additional surgical intervention. Full thickness tears. When used alongside suture anchors, Regeneten reinforces the repair mechanically and biologically, providing superior long-term outcomes. 3. Post-surgical outcomes. The bioinductive properties of Regeneten ensure continuous tissue regeneration post-operatively. In my experience, MRI findings as early as 1 week post-surgery often reveal visible changes, including the formation of new tendon-like tissue. This rapid response significantly accelerates the healing process and reassures both patients and clinicians about the efficacy of the procedure. Enhanced rehabilitation with Regeneten. Regenten's unique properties allow for a more efficient and patient-friendly rehabilitation process. 1. Shortened immobilization. Patients typically wear a sling for just 1 week, compared to 3 to 6 weeks in traditional protocols. 2. Early mobilization. Passive range of motion exercises can begin within the first week, minimizing stiffness and enhancing recovery. 3. Accelerated strengthening. Strengthening exercises can start as early as 6 weeks post-operatively, significantly earlier than the 8 to 10 weeks often required in conventional repairs. This accelerated timeline helps patients return to their daily activities and work more quickly, providing both physical and psychological benefits. Clinical outcomes and observations. The Regeneten implant has consistently demonstrated superior outcomes across various patient demographics. Rapid healing. By promoting tendon regeneration, the implant enhances biological repair and reduces healing time. Reduced pain. Patients experience faster and more substantial pain relief compared to traditional repairs. Improved functionality. Early improvements in mobility and strength enable patients to resume normal activities sooner. Long-term durability. Enhanced tendon quality reduces the risk of retear, even in high-risk populations. My experience with post-operative imaging, showing changes within 1 week, further supports the implant's efficacy in promoting rapid and effective healing. Conclusion. The Regeneten bioinductive implant has redefined the standard of care for rotator cuff repair. By addressing both mechanical stability and biological healing, it offers a comprehensive solution to one of the most challenging areas in orthopedic surgery. With its bioinductive properties, minimally invasive application, and accelerated recovery timelines, Regeneten not only improves outcomes but also enhances the patient experience. Its ability to stimulate rapid tendon regeneration, visible as early as 1 week post-operatively, represents a remarkable advancement in our understanding and treatment of rotator cuff injuries.